This is a 55-bed newborn intensive care unit.
Dr. Stephen Minton has been at Utah Valley Hospital for 38 years. He's never seen anything quite like this.
We have somewhere between 3 and sometimes up to 6 babies who have withdrawal syndromes at any one time.
Oh, there's a sweet little baby in there. Does that baby have an issue?
Yes, that baby is being withdrawn. And so we have a bed that just constantly moves and comforts the baby.
To rock the baby.
And quiet down. And so that it's calming for the baby. Over the course of the last 38 years, we have seen an increase in the drug use, both prescription drug use as well as illicit drug use, that is unbelievable.
Usually opioids?
The most common is opioid use, yes. Now, we have to have a suspicion of drug use in any baby that doesn't follow the normal routine. Any baby whose muscle tone is a little increased, excessive crying, sneezing, diarrhea, you have to look for drugs.
You have to think about it.
You have to think about it. The University of Utah and Intermountain created an algorithm together that's now gone to every hospital in Utah. It's called our Women's and Newborns Quality Collaborative. And if you do that, you can really reduce this down.
So you're a set of questions that you ask, or a computer program, or what is that?
It's a sheet of program. And if you have A, you go to B. If you have B, you go to C.
I see.
This is when you test. This is how long you test.
So you have a protocol.
It's an absolute protocol.
When you encounter a baby that you think might have a problem, maybe has been born with some addiction, what do you do?
Well, because the prevalence has increased so much, we save the cords on every baby who's born for 72 hours.
Umbilical cords.
The umbilical cords, we save them because it's a history in there of the last 4 months of pregnancy. So we save them, and if the baby begins to show signs of withdrawal, we send them, analyze them, and we can tell you what drugs the mother had over the last 4 months.
There was a study of umbilical cords across the state of Utah. What did you find?
There was. It was a survey looking, we didn't put the names on them, we just sent the cords on all these babies. We found 6.8% of all the babies delivered in Utah had evidence of at least one or multiple drugs present in their bloodstream after birth.
7%.
7%. About 2/3 of them, or 4.8% of all the cords that we sent, had opioids present in them.
Almost 5% of babies born in the state of Utah
Yes.
have opioids in their blood.
Yes.
That's unreal.
And I would say that Utah is no different than the rest of the country. So if you take 4 million births a year and you multiply that by 5%, you can see the number of babies who are born that have opiates present in their bloodstream.
Does that disturb you when you take a step back and think 5% of babies being born in the state?
It's frightening. For those of us who care for babies, we know that these babies have been in an environment in their mother for the previous up to 9 months. And that drugs and stuff have an ability to affect the brain development. It can actually even change the structure of the brain. It affects the pleasure-seeking part of the brain. So these children may be at significant risk down the road of having pleasure-seeking activities, whether that be food or drugs or sex or work. And so we may be changing a whole population of people down the road that will have addictive personality.
You may be looking at a whole generation of kids with problems we haven't seen before.
That's correct.